take some teeth, right? Because there are so many incumbents that are doing quite well with the status quo. So number one, you have to be willing to take some risks with constituencies. Put that aside though, because that's not my problem, right? Like my problem is I can build the machine to make it work. How you get that implemented in policy, that's why I'm not in that line of business. But that said, I think it starts with attribution and responsibility for cost, which isn't present in the majority of the people administering healthcare. So that said, I think it help. Maybe what you do is you start with who does hold the bag for cost. And I would say the Medicare the Medicare trustees and the trust fund are one place. I think that we should try to figure out on the commercial side. There are many people in their 40s, 50s, 60s, commercially insured, chronic disease, and their employers are holding the bag, and their employers have a fiduciary responsibility to manage those lives optimally. I don't think that we've totally taken advantage of that opportunity. The employers don't want to be mismanaging or certainly wasting resources on their the employers don't want to waste resources on employees. And so how could we incentivize a more concerted effort among employers, perhaps among consortia of employers? And to a certain extent, you've seen that already, right? That if a large enough cohort of employers came together, they could move the industry, and they could, by delegating through narrow networks to high performance provider organizations. In Medicare, I think the Medicare Advantage vehicle could do that. Um, Gosh, why am I not as excited about it? I think because there are already headwinds against that vehicle, so they could do it. Um, but I haven't seen it happen. I have not seen it happen. The the I think maybe one of the sticking points is member choice, beneficiary choice, employee choice, and there will come a point where the rising pass through to the patient through high deductible health plans or otherwise cost sharing will get to a point where the members are willing to trade their choice for a limited network, which, by the way, will deliver better clinical outcomes. And that's where we're going to get to. So then, if that's the framework, if that's the prediction, how do we get there faster, right? Because in the meantime, we're wasting a lot of money. We're getting worse outcomes. How do we accelerate that process? And I would love to sit with policymakers and think about, if that's where we're going to go, how do we get there now? Like, how can we create employer incentives, or how can we incentivize the Medicare health plans, the MA plans, to do that?